Today, we want to talk about understanding high blood pressure. So, what we want to look at today is what hypertension means for your body, what recent research reveals about hypertension or high blood pressure, and what 3 steps you can take to manage your high blood pressure or your hypertensive numbers. So, firstly, we must understand what is high blood pressure. So, the definition of high blood pressure is it occurs when the force of blood pushing against the artery walls is consistently too high, precisely high above 130 over 80. The normal average blood pressure should be 120 over 80, but if you find that your constant pressure is over 130 over 80, that is diagnosed as high blood pressure. Now, blood pressure is called a silent killer. Now, why is that? This is because it usually has no warning and it can quietly damage your blood vessels, heart, brain, and kidneys over time because the pressure stays high in your body. It means that your heart is pumping at a higher rate, so the pressure on these organs are continuously high, and over time, by continuously being high, they can damage vital organs, and you may not even know that this is happening in your body because there's nothing that you can feel or nothing that you can sense to know that this is going on. And that is why it's called a silent killer. Now, understanding the numbers. So there's 2 numbers. You have the top number and the bottom number, the 120 over 80. What exactly are these numbers? The 2 numbers. So one is systolic and one is diastolic. What exactly is systolic? So systolic measures the pressure during the heartbeat. That's when the heart contracts. That's your systolic pressure. And your diastolic pressure is when the heart relaxes. So you have the 2 pressures. The 120 number at the top, that's your systolic when the heart pumps, and the diastolic is when the heart relaxes. Now, what's the target range for normal blood pressure? The target range for normal blood pressure should be 120 over 80. That should be your target range. It should be 120 or 80 or a little bit lower. That's just optimal health. So you try to get your blood pressure range at least around hovering the average of 120 over 80 or below, and that will be very good for you. Now, research. What does research suggest about this? Now, the global impact, the WHO data says that over 580 million adults worldwide have hypertension without knowing it because they have never been formally diagnosed. This is why getting tested or getting diagnosed, checking on your pressure levels is very important. A lot of people are walking around with hypertension or high blood pressure and they don't even know that they have it. What about the United States? What about the CDC? Well, the CDC says that approximately 11 million Americans have undiagnosed high blood pressure despite visiting their healthcare provider regularly. Now, why is this? And we will look at this a little bit later, but it has to do a lot with your lifestyle. Lifestyle plays a big role in your blood pressure levels, and we will see as we go on in the presentation. Now, the hidden heart condition. Now, recent studies show that nearly 1 in 2 adults over the age of 40 can carry undetected early stage of cardiovascular risk factors without obvious warning signal. Now, that's a big dramatic number. That's almost 50% of people over the age of 40 can be walking around with this silent killer and not even know it because, as I mentioned, of the lifestyle and not getting diagnosed. So, how do we take advantage of getting ourselves with a better lifestyle? How do we make sure that this silent killer is not going to affect us in the future or give us heart problems in the future? Now, step one, we can adopt a heart healthy diet. And what do I mean by that? Now, I'm going to give you 3 steps. How do we adapt this heart healthy diet? One of the big things that drives the pressure up is salt. A lot of salt in the body can cause your pressure to be elevated. Now, what do we do about that? So, we aim for under 2,300 milligrams of sodium per day, ideally around 1,500. I would say a little bit less, go for less. Limit packaged food, canned soup, and heavy table salt usage. Also, following a DASH diet. Now, what exactly is a DASH diet? So, a DASH diet consists of leafy greens, berries, lean proteins, low fat dairy, cutting back on saturated fat and added sugar. Now, that's the other one, sugar. So, you have to reduce your intake of the salt, regular table salt, and sugar. Those 2 things we notice in the lifestyle today are predominantly everywhere you look. So this is one of the reasons why so many people have or are walking around with high blood pressure and don't even realize it, because the daily consumption of these two things, sugar and salt. So the DASH diet, you increase your leafy green vegetables, lean proteins, reduce sugar and reduce table salt, that's sodium, reduce it. Now also what we must do is increase potassium. Now, potassium is very good for the heart, because what potassium does is potassium allows the heart to stay flexible and soft. You see, what the salt does, the sodium in the salt tends to harden the arteries, but the potassium helps to keep the arteries nice and soft and spongy. And that's why we need to use potassium. Potassium helps the kidneys to flush out the excess sodium as well. Also, try enjoying foods which are rich in potassium. That's like bananas, avocados, spinach, and sweet potatoes. One thing I must say, be careful with the bananas. Personal experience, I was trying to eat like 2 bananas a day, but the problem is banana is very high in the glycemic index scale, and it can drive your sugar up. So I would be careful. If you're going to eat bananas, try eating the green bananas instead of the very ripe bananas. Those are very high in the glycemic index scale, and those can elevate your sugar levels. Now, if you think that the bananas might be too sweet for you, I would just go with the avocados, spinach, and sweet potatoes. That's what I recommend, because that's what I do for myself as well. Now, step two, we must stay active. One of the things that you can do to lower your blood pressure levels is being active. You see, over time, as we get older, we slow down in our lifestyle. We exercise less, we move less. This is one of the factors that affect us dramatically with increasing our blood pressure level, because as we slow down, the heart works less. So the heart is becoming less elastic. So what we can do is 150 minutes of moderate exercise per week. This can include things such as brisk walking, cycling, swimming, or light jogging. These can really help you to keep the body moving, keep the blood moving, keep the heart pumping. Another thing that you should do is something called high intensity exercise and some weight lifting. Weightlifting are very good for you, because this actually fires up certain neurons in your brain that puts pressure on the heart, so that the heart can just get back that elastic movement. Now, here's the thing, when you're going to do the high intensity exercise, just do a quick 30 seconds and stop. Don't go too long. And if you're going to do heavy lifting, don't do too much. Just do 1 or 2 or 5 reps of heavy lifting, so that you can put back that hormone in the body to challenge the brain. When you do some heavy lifting, it actually fires up the neurons in the brain, which puts some pressure on the heart, which allows the heart to give those pumps, which probably was missed as you were slowing down, as you were getting a little bit older. Now, weight management. Weight management impacts high blood pressure, and it also impacts diabetes. But we're focusing on high blood pressure today. Now, weight management. Now, blood pressure often decreases as the body weight decreases. So the more weight you gain, you're actually putting more pressure on the heart to pump blood through the body. So one of the things that we can do is actually try to lose some weight. 5 to 10 pounds would make a dramatic difference in your blood pressure level, especially you see as you're gaining weight. If you notice, when you gain the weight, most of the weight you gain is around the midsection or stomach area. That's called visceral fat. Now, this visceral fat tends to try to cover up all of your vital organs, such as your liver and all of that, slowing down the metabolism of the body. Heart has to pump more blood to supply these vital organs. Also, what can happen is, as a result of accumulating that fat and high cholesterol, it can start blocking your arteries and vessels, which means that the heart has to push harder or work harder to have blood pass through those black passages. That's why you definitely want to lose some pounds. Also, build a daily movement habit. Take the stairs, park further away. Most of the times when we go to the store, we want to park right in front of the store. But if you incorporate these lifestyle changes, such as you park a little bit further from the supermarket when you go grocery shopping, so you'll get those extra numbers of steps in. You, instead of taking the elevator, you take a flight of stairs. And by doing these little things on a daily basis, it can definitely help you to improve your lifestyle habits and to manage your blood pressure levels. You want to keep the blood circulating smoothly through the body. Now, step three, manage stress and daily habits. This is a big one. Stress always elevates your blood pressure. You see, when you stress, there's something, a hormone release called cortisol, and cortisol have a tendency to just spike sugar and spike your high blood pressure. So what do? Reduce the chronic stress. Stress causes temporary spikes in blood pressure. Practice mindful deep breathing exercise or daily relaxation technique. You can do deep breathing exercise. Try breathing in through your nose and breathing out through your nose. Try breathing in, holding it for about 4 seconds, breathing out for 4 seconds, relaxing for 4 seconds, breathe in again for 4 seconds. That's called box breathing. That can definitely relax your body and help you to reduce stress. Avoid thinking about things that are unnecessary. Avoid thinking about things that you find yourself, when you start thinking about it, you just feel like your heart is racing. You have to find a way to try to turn off those things, because they'll keep your pressure elevated, they'll keep your heart overworking. Avoid tobacco and alcohol. Now, nicotine temporarily raises blood pressure and damage the blood vessels, and that's something that you definitely should stay away from, period. You should stay away from smoking, you should stay away from nicotine, all these things like vaping, and stay away from these things, because one of the things that they do is damage your blood vessels, and that can cause other severe problems in the body. So limit these things, because they tend to raise the blood pressure, because you're putting more stress on the body. The lungs have to come on more now and get all that harmful toxins out of the body. The blood filtration process, the kidneys have to work harder, the liver has to work harder, the heart has to pump more blood. All of these things, because now those toxins are in the body, the heart has to work harder to get those toxins out of the body. Sleep. Prioritize good quality sleep. 7 to 9 hours of good quality sleep every night will definitely help you to bring down your blood pressure levels. Most people don't get good quality sleep at night. They're waking up around 2, 3 a.m. at night. That's because the cortisol level is not balanced. And a result of that, it disrupts the heart rhythm and it elevates your blood pressure level. So prioritize good quality sleep each night. Try to get to bed before 10 p.m. each night. Put away the phone, the blue light. Just unwind from your day and fall into that deep sleep, and try to sleep as much as possible during the night. So making these lifestyle changes stick. Now, these are lifestyle changes, and sometimes you might say, well, my schedule is very hard, or I have a very busy schedule. How can I incorporate this schedule? How can I incorporate this diet or this lifestyle? It's very easy. It's very simple. You don't have to make all the changes at once, but what you can do is take small steps to incorporate these changes. Simply start by walking maybe 15 minutes a day. Any little small changes you start making will definitely help you in your journey. Remember, this is about a lifestyle change. It's not a one shot cure to fix the problem, but small lifestyle changes will get you there. So if you can't walk 30 minutes a day or exercise 30 minutes a day, start off with 15 minutes a day. Start off just walking 50 minutes a day, or riding a bike 50 minutes a day, or maybe swimming 15 minutes a day. That will start getting you in the right direction to optimize your health. So small steps will help to get you on that track. Now, track and celebrate your progress. You want to stay motivated and keep yourself motivated as you're going, because remember, you're actually challenging your body to do something that you weren't doing all this time. So what you want to do is keep a daily log of your blood pressure reading, your meals, and your activity. Track it so you'll see, well, wow, and also track your weight. That was a big one. Track your weight, see how you're moving on the chart, see if you're losing weight. And I can guarantee you, as you're starting to track your progress, you will get the motivation. You will start to see, wow, you start to feel better. And this will encourage you to keep going, because you know that you're heading into optimal health and this lifestyle change is actually working in your life. So then also what you will do, you'll be seeing gradual improvements. This will keep you motivated and provide encouragement for you. So definitely when you start this, make sure you do this step. This is a step I would encourage you to focus on each day. track your progress. And then also, you can partner with your care team. So, work closely with your healthcare provider to monitor the trends, adjust prescribed medication when necessary, and tailor an action plan tailored to suit and fit your daily lifestyle habits or routine. Definitely, if you incorporate these steps into your diet, you start eating much more green vegetables, you start eating much more lean protein, reduce the salt, reduce the sugar, get your 7 to 9 hours of sleep, exercise at least 50 minutes to 30 minutes per day. You need at least 150 minutes of exercise per week, which is 30 minutes for 5 days a week. But if you start at 15 minutes a day, you will definitely start to see changes in your blood pressure levels. Now, you may say, well, I'm at the point in my life where I can't move a lot. You can simply just start moving your arms. Move your arms, move your arms, move your legs. Get the blood moving. Don't let your body stay stagnant because, as I mentioned, when the body stays stagnant, things slow down. Muscles start to lose their structure, and you want to have the muscles maintain their structure, maintain that ability to keep moving and allowing the heart to pump as much as possible. It will take lifestyle changes. You can do it. You just have to begin. And as I mentioned earlier, if you can't do 30 minutes of exercise each day, start off with 15 minutes. Just walk 15 minutes. Just reduce the sugar, reduce the salt, start exercising, add more greens, increase foods with potassium, broccoli, spinach. It will definitely help you on your wellness journey. Optimal health is something that we all can achieve. It's all about lifestyle changes, lifestyle choices, and also remember to track your progress. Tracking your progress will motivate you and get you on the right path to maintaining optimal health. I hope that this information helped you so that you can maintain your optimal blood pressure levels. Remember not to stress about it because stressing about it only elevates it. What you want to do is just take daily steps. The changes will not come overnight, but you have to make the effort on a daily basis, and small steps will get you on track to maintaining an optimal blood pressure level. Remember to follow us for more health, wellness, and herbal tips. And always remember that your health is your wealth.